Assalamu alaikum. I am Dr. Farida Akhter, Professor Current Charge, Dept. of Biochemistry at the Women's Medical College. Today I am going to take a class topic lipids and fatty acid. After the end of the session, students will able to know about the definition of lipid and classification of lipid, and then the fatty acids definition and classification, and their source, function and biomedical importance. So first, lipid. We can define lipid as the heterogeneous groups of compounds which are relatively insoluble in water but soluble in fat solvents. So what are the fat solvents? Common fat solvents are benzene, ether, chloroform, alcohol. Now we can classify lipid according to three categories like simple lipid, complex lipid and derived lipid. Simple lipid. What is simple lipid? We can define simple lipid as the starch of fatty acid with alcohol, and this simple lipid don't contain any non-lipid substances. Example of simple lipid are neutral fat and wax. So what is neutral fat? Neutral fats are starch of fatty acid with glycerol. It is also called triacylglycerol or triglyceride. Chemically, this neutral fat composed of 3 fatty acid with 1 glycerol molecule. They are regarded as neutral because they don't have any charge in the normal body pH. This neutral fat remains liquid state in, and they are called oil. Example of this neutral fat is vegetable oil, fish oil. Then wax. Wax are the starch of fatty acid with long chain monohydric alcohol. Example of wax are retinol ester, that is retinol plus fatty acid, cholesterol ester, cholesterol plus fatty acid, and vitamin D ester, that is vitamin D plus fatty acid. Now our second classification, that is complex lipid. Complex lipid may be defined as the starch of fatty acid with alcohol along with other non-lipid substances. These non-lipid substances may be phosphate group, may be carbohydrate, may be protein. Example of complex lipids are phospholipid, glycolipid, lipoprotein and other complex lipids. Now phospholipid, starch of fatty acid with alcohol attached with phosphoric acid with or without nitrogen base, but in most of the cases nitrogen bases are present. Biomedical importance of phospholipid. Phospholipids constitute the biological membrane, that is the cell membrane. Membrane phospholipid provides arachidonic acid for the synthesis of eicosanoid. Phospholipid helps in coagulation and lipoprotein formation. Phospholipid acts as a surfactant in the liver to prevent collapsing of the alveoli. Here the phospholipid is dipalmitoyl lecithin. They also act as second messenger of hormone, and here phosphatidylinositol is the phospholipid. Another phospholipid, lecithin, acts as a lipotrophic factor to prevent fatty liver. In bile, phospholipid solubilize cholesterol and prevent cholesterol formation. Another phospholipid, cardiolipin, a major mitochondrial phospholipid. Deficiency of this cardiolipin may cause heart failure and aging. Then glycolipid. These complex lipids contain carbohydrate. So their composition is fatty acid plus alcohol plus carbohydrate. Another complex lipid is lipoprotein. They are composed of lipid and protein. Lipids present in this lipoprotein are mainly triacylglycerol, cholesterol ester, free cholesterol and phospholipid. Important lipoproteins are chylomicron, very low density lipoprotein or VLDL, low density lipoprotein or LDL, high density lipoprotein or HDL. Then third classification, derived lipid. So derived lipid are obtained by the hydrolysis of simple lipid and complex lipid, which still possess the general characteristics of lipid. And we know the general characteristics of lipid are they are insoluble in water but soluble in fat solvents. So derived lipids are obtained from hydrolysis of simple lipid and complex lipid that still possess the general characteristics of lipid. These derived lipids are fatty acid, cholesterol, steroid, alcohol, cholesterol, prostaglandin, ketone bodies, fat soluble vitamins like vitamin A, D, E, K, and hormones, especially the steroid hormones in our body, that is testosterone, estrogen, progesterone, aldosterone, cortisol. We can classify lipid into another category like non-polar lipid and polar lipid. Non-polar lipid, they are hydrophobic and water insoluble. Example of these non-polar lipids are triacylglycerol, cholesterol ester, retinol ester, vitamin D ester. Now come the polar lipid or amphipathic lipid. These lipids are hydrophilic with limited water solubility. These lipids have both polar or hydrophilic group and non-polar or hydrophobic groups and show limited degree of water solubility due to their hydrophilic polar groups. So what are the polar groups of these amphipathic lipids? In case of fatty acid, the polar group is carboxyl group. In case of phospholipid, the polar group is phosphate group and nitrogen group. In case of glycolipid, the polar group is carbohydrate group moiety, and in case of bile salt, the polar group is hydroxyl group, taurine and glycine. In cholesterol, the polar moiety is hydroxyl group, and bile acid polar moiety is also hydroxyl group. So amphipathic lipids are lipids that are both polar group and non-polar groups, and they show limited degree of water solubility. Now the dietary lipids, that means from which dietary source we can get the lipids. Major dietary lipid is the triacylglycerol, that is about 90% of our dietary lipid, and others are cholesterol and phospholipid. We can get these dietary lipids from both animal source and plant source. Animal sources are egg, meat, fish, milk, butter, ghee, etc. And from plant source we get from dalda, vegetable oil like soybean oil, sunflower oil, mustard oil. Now the biomedical importance of this triacylglycerol or fat. This fat is the source of energy and the important storage form of energy in our body. They helps to provide the essential fatty acids and helps absorption of fat soluble vitamin in our body. They also act as subcutaneous thermal insulator and perineural electrical insulator. They help in cosmetic function. They give shape and contour of the body. Fat also add taste and palatability of food. But high plasma triacylglycerol increase the risk of fatty liver disease, acute pancreatitis and coronary artery disease. Now the biomedical importance of cholesterol. First, the advantage. Cholesterol constitute the biological membrane. They act as a precursor of synthesis of steroid hormone, bile acid and vitamin D. And the disadvantage of cholesterol, high plasma cholesterol is associated with atherosclerotic disorder like stroke, coronary artery disease, etc. Then our second point, that is fatty acid. What is fatty acid? We can define fatty acid as the carboxylic group containing aliphatic organic acid. Carboxyl group containing, this is the carboxyl group. Carboxyl group containing aliphatic organic acid. They are weak acid, and fatty acids are amphipathic in character, having both hydrophilic and hydrophobic part. And short chain fatty acids are more or less water soluble because their hydrophobic hydrocarbon chain portion is short. Fatty acids are distributed in our body in two forms: free fatty acid bound with albumin, that is 5%, and free fatty acids star with alcohol, that is 95%. Among these, triacylglycerol is 45%, phospholipid 35%, and cholesterol star 15%. We can classify fatty acid into three categories. Number 1, based on total number of carbon in the chain length: short chain fatty acid and long chain fatty acid. If the carbon number in the chain is less than 10, we can say it is short chain fatty acid. Example, acetic acid and propionic acid. And the source of this short chain fatty acid is in milk. If carbon number is more than 10 in the chain length, it is long chain fatty acid. And the example of this long chain fatty acid is palmitic acid, stearic acid. Now, second classification. Fatty acids can be classified based on saturation of carbon. They may be saturated fatty acid and unsaturated fatty acid. Saturated fatty acid. This fatty acid do not contain any double bond in their hydrocarbon chain. They remain solid in room temperature. Example, palmitic acid, stearic acid. Unsaturated fatty acid. This fatty acid contain one or more double bond in their hydrocarbon chain. They remain liquid in room temperature. If the chain contain one double bond, then it is called monounsaturated fatty acid. If the chain contain two or more than two double bond, they call polyunsaturated fatty acid. The example of monounsaturated fatty acid are oleic acid and palmitic acid, and we can get this monounsaturated fatty acid from the source of olive oil, canola oil. Polyunsaturated fatty acid, that is, they contain two or more than two double bond in their hydrocarbon chain. Example are essential fatty acid, and we can get these essential fatty acids from fish oil, vegetable oil. Example is coconut oil and palm oil. Example, this is the exception. Then nutritional classification of fatty acid. We can classify fatty acid nutritionally: non-essential fatty acid and essential fatty acid. Non-essential fatty acid. These fatty acids are produced in our body, so their presence in the diet is not essential. They are palmitic acid, stearic acid. Essential fatty acid. These fatty acids, our body do not produce these fatty acids, so their presence in the diet is essential. That's why they are called essential. I repeat, as they are not synthesized in our body, so their presence in diet is essential. That's why they are called essential fatty acids. Some essential fatty acids are linoleic acid, linolenic acid, and arachidonic acid. The common source of these essential fatty acids are vegetable oil like soybean oil, sunflower oil, mustard oil, then fish oil, cod liver oil, egg yolk. Now the source of fatty acid: endogenous source and exogenous source. Endogenous source: synthesis of fatty acid within our body is the endogenous source, and exogenous source, that is the dietary source or outside source. They are divided into animal source and plant source. We can get the fatty acid from animal source like animal fat, milk, butter, ghee, dalda, coconut dalda, and plant source is the vegetable oil, coconut oil, and palm oil. Importance of essential fatty acid. Fatty acids acts as a precursor of eicosanoids. They act as component of biological membrane and maintain its fluidity. They reduce the plasma cholesterol by increasing cholesterol excretion from bile. Fatty acids also helps in gonadal function and reproduction. They support oxidative phosphorylation. They also helps in vision and growth. Then we can numbering and designation of carbons in the fatty acid. how can we give them numbering? Carbon atoms of the fatty acids are numbered starting from the carboxyl end. Carboxyl end carbon, this carbon as carbon 1, then proceed serially towards the methyl group of the carbon, methyl group. So this carbon numbering starts from this carboxyl group. This carbon is carbon number 1 and proceed serially to methyl group of the carbon. The carbon adjacent to the carboxyl group, this carbon, carbon number 2, this carbon, carbon number 2 adjacent to the carboxyl group is called alpha carbon. I repeat, alpha carbon is carbon number 2 that is close to the carboxyl group. Then carbon number 3, this carbon, carbon 3 is called beta carbon. Beta carbon is carbon number 3. Then carbon number 4, this is called gamma carbon. So gamma carbon is carbon number 4, and in this way the last carbon that is in the methyl group, that is termed as omega carbon. So omega carbon is the last methyl group containing carbon is called omega carbon. So here we again see the carbon adjacent to the carboxyl group called carbon 2, also known as alpha carbon, and next carbon, that is carbon 3, also known as beta carbon. Carbon 4 is known as gamma carbon. The terminal methyl carbon, the carbon furthest from the carboxyl group at the non-polar end of the hydrocarbon chain is known as the omega carbon. Omega carbon regardless of the chain length. Here we see this is the carboxyl group containing carbon, that is carbon number 1. Carbon close to this carboxyl group is regarded as carbon number 2 and called alpha carbon. And then next carbon, carbon number 3 is called beta carbon, and then carbon number 4 is called omega carbon, and the last carbon, that is the methyl group containing carbon, is called omega carbon. This is how we are numbering the fatty acids. Then there are two types of numbering. One is delta numbering system, another is omega numbering system. So first we say about the delta numbering system. Here the carbon atoms of unsaturated fatty acid are numbered beginning at the carboxyl group. Total number of carbon, total number of double bonds and the position of the double bonds are indicated numerically. First number indicate total carbon number, second number indicates number of double bonds, and the third number and onward indicates the position of the double bond. Like here linolenic acid 18, 2, 9, 12. So the first 18 indicates the total carbon number in the fatty acid, and there are two double bonds. These two indicate there are two double bonds in the whole chain. And now the last 9 and 12 indicates the position of the double bonds. So first double bond placed in carbon number 9 and 10, and the second double bond present in carbon number 12 and 13. So in delta numbering system, first number indicates the total number of carbon in the chain length, and then second number indicates the number of double bonds, and the onward numbers indicate the position of the double bonds. Now the omega numbering system, and we know that omega numbering system, omega number is the last, that is the methyl group containing carbon is the omega carbon. So this omega numbering system we should start counting from the methyl group. Here the carbons of unsaturated fatty acids are numbered begin at the omega carbon end, that is the methyl end of the chain. In this form, polyunsaturated fatty acids are often classified as omega-3 fatty acids, omega-6 fatty acids, etc. according to the position of the first double bond from the omega carbon. I repeat, first double bond counting from the omega carbon, that is the methylene containing carbon. So, what is omega-3 fatty acids? Here the first double bond closer to the omega carbon ends begin at the third carbon counted from this end. I repeat, omega-3 fatty acid, the first double bond close to the omega carbon end begins at third carbon counted from this end. And the example of omega-3 fatty acid is the linoleic fatty acid, linolenic fatty acid. Omega-6 fatty acid, here the first double bond closer to the omega carbon end begins at the sixth carbon from this end. I repeat, this here the first double bond closer to the omega carbon end begins at the sixth carbon from this end. Example of this omega-6 fatty acids are linoleic acid, arachidonic acid. So, omega-3 fatty acid, we can get this omega-3 fatty acid from oily fish, seafood, sea fish, olive oil, vegetables. And the function of this omega-3 fatty acid is that they reduce inflammation, they reduce chance of malignancy, and they reduce the joint pain and inflammation. They are good for cardiac health and reduce the chance of coronary artery disease. They reduce anxiety and depression. Omega-3 fatty acid decrease plasma triglyceride level and reduce the synthesis of VLDL in liver. Now, omega-6 fatty acids, we can get them from vegetable oil like sunflower oil, coconut oil, nuts, seeds, fish and meat. Now, some points about omega-3 and omega-6 fatty acids. Omega-3 fatty acids reduce inflammation, that is anti-inflammatory. But omega-6 fatty acids cause inflammation, that is they are pro-inflammatory, they increase the chance of heart disease, cause high blood pressure and cause vasoconstriction. So, finally, we can say that omega-3 fatty acid is better than omega-6 fatty acid and omega-6 fatty acid is better than saturated fatty acids. So, these are all about my today's topic, that is lipids and fatty acids. Thank you all.